This conference will now be recorded.
Am I audible?
Yes, sir.
ఇంకా జాయిన్ అవుతూనే ఉన్నాం కదా. జ్యోతి ప్రకాష్, జ్యోతి ప్రకాష్ ఏం చేస్తున్నాడు?
సార్ గ్రూప్ లో పెట్టా సార్, జాయిన్ అవుతున్నా.
ఏం బాబు ఎలా ఉన్నావు? జ్యోతి ప్రకాష్, హౌ ఆర్ యు?
బాగున్నా సార్, ఫైన్.
ఏంటి ఎనీ అప్డేట్స్ ఇన్ ద కాలేజ్? మీకు మన ఇంటిమేషన్
హెచ్ఓడి సార్ చెప్తున్నారు కదా సార్, కాలేజ్ నవంబర్ నుంచి పెడతాం.
ఏమని చెప్తున్నారు?
అంటే ఈ మంత్ 25th కల్లా కోవిడ్ పేషెంట్స్ ఉన్న వాళ్ళని గవర్నమెంట్ షిఫ్ట్ చేస్తారంట కదా.
ఓకే ఓకే, నాకు తెలియదు.
వాళ్ళని ఇంకా చేసేస్తే మనకి ఇంకా కాలేజీకి రావడానికి ఫ్రీ అని ఏదో చెప్పారు సార్. మరి మాక్సిమం నవంబర్ లో స్టార్ట్ అయిద్దండి.
ఓకే ఓకే, am I audible to everyone?
Yes, sir.
So today we will be, so I am starting the class anyway. Okay, time is a little short. Okay, so the most మా PPT కనబడుతుంది కదా?
Yes, sir.
Yes, sir.
Yeah, good, nice, good. Okay, either way, see, we will deal with a very important topic nowadays. A little concern about all these things, that is mental health. So what is the WHO definition of health? Anyone? WHO definition of health, it's a state of complete physical, mental and social well-being. Physical, mental and social well-being, and one of the foremost health, that is mental health, which has to be maintained at its highest point. Why? Because without accomplishing the individual mental health, you cannot accomplish anything in your life. That's what nowadays the concern is growing and growing. Why? Because so many mental health disorders, so many this neurosis, psychosis, everything is related to mental health. You take any disease, either communicable or non-communicable, whether it is organic, multifactorial, one of the foremost risk factor is deterioration from your state of mind. If you are being deteriorated from your mind, so obviously it will cause damage to our body in one or another way. That's why nowadays the concerning factors about mental health is growing and still growing. So many national health programs have been implemented. Now it has been incorporated into our day-to-day lifestyles also. That's why in so many companies also, like private institution, government institutions, they are providing some, in between working hours, they are providing some relaxation procedures. Whatever it is, they provide in our these things. department. So we will deal with the mental health. So at the end of the in 2 classes we will deal with this mental health program. I mean they are all health about mental health. So what is the prehistoric events regarding mental health? What are the changing concept in mental health? Okay. Then what are the main objectives? Why we have to be mentally healthy in order to achieve what? Okay. And what are the various questionnaire methods, or what are the various measuring tools for our in criteriation to say that a person is mentally healthy or mentally ill health? So what are the international classification of diseases of these psychiatric disorders? What are the major causes? What are the minor causes? What are the major diseases in psychiatric disorders? Okay, and what are the main reasons for this? What do you mean by drug abuse? What do you mean by drug dependency? Okay, all these things we have to know. This is an once again I am telling you, very important aspect, both in your examination point of view and viva point of view, as well as day to day survival of our life too. ఇది ఏదో ఒక రోజుకో 2 రోజులకో ఎగ్జామ్ కోసమో కాదమ్మా, మన లైఫ్ టైం కోసం ఇదంతా. You have to know it, you have to practice it, and you have to teach to the other people also. Why? Because it's a growing concern nowadays. So prehistoric times, what they did is mental MI means mental illness, not myocardial infarction. Please do note. MI means mental illness. So previously what they thought is, if any person is behaving improperly or ill-behaved manner, he possessed with some evil spirits, or somebody casts spells on him. This is the prehistoric event. So what they did is drilling a hole through skull to allow evil spirits to escape. See, it's a clear cut in it. It's a skull. It's a realistic photograph. What they did is, in prehistoric times, they drill a hole in a human skull so that evil spirits can escape through that. And 90% of survival rate is there. 90% of survival rate. We don't know the reasons, because if some person is drilled through this, he survived and he is relieved from all his psychiatrical illnesses. That's what they believe. And when it comes to the ancient Greece and Rome, they believed that these mental illness due to from environment, and they provided some public funding for treating sickness. See, and again Middle Ages, again superstition returned, and they named it as exorcisms. For the treatment purpose, in an exorcism name, they have done everything during Middle Ages. And during 15th century to 18th century, mental asylums were formed, and these are the first ones. All those people who are sick, mentally sick, they have been taken into a separate institution, and they will be treated there. But in those days, abusing and sufferings were more common for these mentally ill patients, very more common. Why? Because of negligence. Yeah, in even in early 20th century also, people made that this is from the brain disorders, but nobody believed them. And very brutal treatments were offered to the patients. See, very brutal treatments. Nerve fibers have been cut. Okay, so what they did is like these kinds of treatment. Even a lobotomy, the treatment name is lobotomy. Even though the symptoms disappeared, patients remains apathetic and childlike, and not before than that. Mundu ela aithe unnaro ala తీసుకొచ్చడానికి impossible. These are some brutal treatment regarding in 1950s, just 100 years ago. So in the present situation, deinstitutionalization, that means medication and therapy were using nowadays to treat the mental illness. A lot of rehabilitation measures also have been provided to these people to become more productive for the society. So have you ever heard all these people do suffer from mental illness? Lincoln, he is fond of depression after becoming president, not before president. After becoming president, he used to have psychiatric illnesses like depression. So Charles Darwin, he feels he had a disorder called agoraphobia. What do you mean by that? Agoraphobia? Anyone? Agoraphobia. Anyone? Are you people following me? Ma,
Yes,
are you
sir.
following? వినపడుతుంది కదా? మరి ఒక్కరు
Yes,
రెస్పాండ్
yes,
ఇవ్వరు.
sir.
Yes,
సో వాట్ యు మీన్ బై
వినిపిస్తుంది సార్.
చెప్తాను మానస చెప్పండి.
Anxiety, oh, fear of open places, sir.
వెరీ గుడ్ మా అంజం. ఫియర్ ఫర్ ఓపెన్ ప్లేసెస్. Then Munich, okay, famous artist, he had a panic disorders. Winston Churchill, he is also having a bipolar disorder. Famous lyricist and musician Beethoven, he is also suffered from bipolar. Michelangelo is the greatest artist till now. He had a disorder called autism. Okay, so mental dimension, so it is one of the dimensions in health, in changing concepts of concepts of health and diseases. So various dimensions were there. Among that, mental dimension is also among one of the important one. It stated like it is a state of balance between the individual and the surroundings of the surrounding world, and a state of harmony with oneself and others, and between the realities of the self and that of other people and that of the environment. Each and every line is important in this line. A state of balance. It's a state of balance between the individual and the surrounding world. నీ నీ మైండ్ స్టేటస్ లోని నీకు నీ చుట్టుపక్కల ఉన్న ఎన్వైరాన్మెంట్ కి ఉన్న ఈక్విలిబ్రియం స్టేటస్. How you are reacting to the your surroundings, and a state of harmony, peace, that means a state of harmony with oneself. You should be happy with yourself and you should be harmony with yourself. You should be having peace with yourself and with the others also, and with the realities, what is actually going on and what is actually going on with your mind. నిజంగా భౌతికంగా జరగడానికి మనకు మానసికంగా మనకు అది తెలియడానికి ఆ స్టేట్ ఆఫ్ మైండ్ విత్ అదర్ పీపుల్ అండ్ విత్ ద ఎన్వైరాన్మెంట్. దిస్ ఈస్ a mental dimension. That is what they define a mental health. It's a state of balance between the individual and the surrounding world, and a state of harmony with oneself and others, and between the realities of self and that of other people and that of environment. The definition is very important. See, I already told you people, psychological factors, those play very important role in not only in mental illness but also organic illnesses or systemic illnesses like essential hypertension, peptic ulcers, bronchial asthmas, so many disorders, so many disorders, immunocompromisation state. All these things will be happening due to lot of psychological factors. So how you have to evaluate from mental health? I already told you there are no precise tools to assess the mental health. At the individual level they have provided with some questionnaire, and in further slide I will explain you what are those questions, yes or no type. But this is also given in your book, that is a mentally healthy person is free from all internal conflicts, okay, and he is not in a war with himself, and he is well adjusted to the surroundings, and he had a strong sense of self esteem, he and she both, and he knows himself, and he will know, and he will accept the criticism, okay, and he will take whatever the people will do, and he will try to improvise himself, and he has a good self control balances, and she faces problems and try to solve them intelligently and emotionally. Both all these things are important, and these are the state of a good mental health. If all these present, we can say that the man is well balanced both physically and mentally. Just remember the words, okay. He is not in a war with himself, he is well adjusted to his surroundings, he accepts the criticism, and he had a strong self-belief, strong esteem, he knows himself, he never underestimates or nor overestimates himself or his abilities. That is also an important aspect. And at the population level lot of questionnaires will be there. See, these are the, what are the characteristics of a mentally healthy person? So what should be a person having, he is a, whether you have to define he is a mentally healthy person? So these are the things. He feels comfortable about himself, always he is comfortable, not always in a kind of tension or some kind of depressive mode or some kind of that thing. వాళ్ళలో వాళ్ళు తిట్టుకుంటూనే ఉంటారు, వాళ్ళ వాళ్ళ పరిస్థితులను బట్టి, వాళ్ళ వాళ్ళ పనులను బట్టి, వాళ్ళ వాళ్ళ థింగ్స్ ని బట్టి. సమ్టైమ్స్ ఆల్వేస్ ద పర్సన్ బ్లేమ్స్ హిమ్సెల్ఫ్, నా జీవితం ఇంతే, నా కర్మ ఇంతే. So that is not a characteristic of a mentally healthy status, okay. Some kind of ill health is there, if at all self blaming is there. Always do mind that self blaming is an very bad character, very bad attitude. Never ever blame yourself. Whatever the reason happened, you will learn a lesson from that, and you will know whether it is a good or bad. You will learn a lesson from that. Self assessment should be there, not self blaming. మళ్ళీ సెల్ఫ్ బ్లేమింగ్ చేయకూడదని ఏమేమో చేసేసి నేను మంచిగా చేశానని అనుకోకూడదు. That is self assessment. Whether you have done a thing, you have to assess yourself, okay, how much far it is helpful for me, how much far it is helpful for my surrounding people, how much it is helpful for the nation, how much is helpful for the internationally, how much people are being benefited from my work. In that way you have to self assess how many people are suffering from this work, that is your work. In that way you have to self assess, but you should not blame yourself whether the outcome is good or bad. Okay, if it is good, fine, you have to improve your skill and go to the next level. If it is bad, try to regain all your evaluation and try to correct your steps, again reproduce it. Okay, that is the thing we have to feel about. He always feels comfortable about himself, and he feels right towards others too. He feels right towards others too. Why? Because always, that's what I am telling you. You should not blame yourself and you should not blame others too. Whatever the person did to your himself or others, you should not blame it. Okay, you should always find a correct reason. So many assessments will be there based on your actions or others action. Definitely action will be taken, but you should not judge, you should not feel wrong. And then he is able to meet his demands of life. That is what is important. That is, he is able to check his quality of life. He always go for his quality of life. That is what is meant by that. Meet the demands of life. And a mentally healthy person is generally equated with happiness, satisfaction, and with normal behavior and harmonious working with the mind with others also. These are the some characteristic regarding mentally health. So these are the warning signals of poor mental health condition. These are the warning signals. This and the next slide is very, very important for you people. Why? Because so many times this has been asked in your examination. What are the warning symbols or warning signals for poor mental health? All these questions should be considered. Please do make a note all these questions. Are you always worrying? Are you always unable to concentrate because of unrecognized reasons? You are unable to concentrate and you don't know the reasons also. You thought that there are so many reasons for you that not able to concentrate, but there is no valid reason for that. And are you continuously unhappy without justified cause? You can see some people are there continuously unhappy without valid reasons. Without valid reasons. That is also a warning signal. Next, do you lose your temper easily and often? No. Always you should not lose your temper. You should not lose your temper easily. You should not lose your temper very oftenly. ఎదుటోళ్ళు మనం అనకూడదు, అబ్బో వీడు చాలా టెంపర్ క్యాండిడేట్ రా బాబు, వీంతో పెట్టుకోకూడదు. నో, అలా ఉండకూడదు. Are you troubled by regular insomnia? This is also a warning signal. Not able to sleep in a day, in a 24 hours of a biological cycle, you should be able to sleep at least 6 hours continuously, not in a faded manner. Continuously you should be having a 6 hours of sleep. So if you are troubled by a regular insomnia, then you are having some kind of mental illness. And then, do you have wide fluctuations in your moods from depression to elevation and then back to depression, which incapacitate you? This is a kind of bipolar people. Sometimes they see very, very excited and sometimes you see very, very depressed. Yeah, it's very common. It's emotionally very common to feel. Sometimes you will be having euphoria and sometimes you will be having depressive mood. Not like that very hyper mode and very low depressive mode. That is what is meant this question. Wide fluctuation. Ma, are you people able to follow? అర్థమవుతుంది కదా?
Yes, sir.
Yes, sir.
Very good.
Yes, sir.
Why? Because all these things were important. మీరు ఎప్పుడైనా ఒక మెంటల్ ఒక ఒక పర్సన్ ని మెంటల్ గా హెల్తీగా ఉన్నాడా లేడా అని డయాగ్నోసిస్ చేయడానికి ఈ క్వశ్చన్లు అడిగితే చాలు. అండ్ యూ విల్ ఫేస్ లాట్ ఆఫ్ పీపుల్ ఇన్ యువర్ లైఫ్. మీ జీవితంలో కలుసుకునే వాళ్ళు ఎంతో మంది ఉంటారు ఇప్పటి నుంచి కూడా వేసుకున్నా కూడా. అందుకే ప్రతి పర్సన్ ని వెంటనే జడ్జ్ చేయకుండా ఇవన్నీ మనకి ఉన్నాయా లేదా అని చూసి దెన్ యూ హ్యావ్ టు డిసైడ్ వెదర్ హీ ఈస్ హ్యావింగ్ ఏ మెంటల్ ఇల్నెస్ ఆర్ నాట్. దట్స్ వై యూ హ్యావ్ టు కీప్ ఇట్ ఇన్ యువర్ బ్రెయిన్ ఆల్ దీస్ థింగ్స్. ఓకే, నెక్స్ట్. The next question: do you continuously dislike to be with people? So some people, they don't feel they're liking to meet with the other people. He always self isolates. He don't want to be with other people. That is also a warning signal for that. And are you upset if the routine of your life is disturbed? Okay, if at all your routine life is disturbed, are you upset? Not always. I mean, always you upset. Sometimes our daily routine will be interrupted, but we should not upset with that. And then, do your children consistently get on your nerves? Continuous ga మీ పిల్లలు మిమ్మల్ని బాధ పెడుతున్నారా? కంటిన్యూస్లీ getting on your nerves. Are you browned off and constantly bitter? Browned off means losing your facial expressions. And are you afraid without real cause? There won't be any cause, but the people were afraid because oh, ఇలా అయిపోతుందేమో, ఇలా అవుతుందేమో, ఇలా అయిపోతుందేమో అని లేని దానికి కూడా భయపడుతూనే ఉంటారు. Are you always right and the other person is always wrong? This is also a very wrong signal with a very bad mental attitude. Some people always process that I am always right. Whatever I am doing, I am always right. And whatever the other people are doing, they are always wrong. In their state of mind, they constantly think that all the others are wrong and I am right. No, this is also a warning signal. Then, do you have numerous aches and pains for which no doctor can find a physical cause? కొంతమంది ఎల్లగాని చెప్తారు, అబ్బా నా బాధలకు మందు లేదండి, నా నొప్పులకు దారి లేదండి అని ఓ ఏదో బాధపడుతున్నట్టు చెప్తారు. నో, దట్ ఈస్ ఆల్సో a warning signal. Okay, so these questions have been framed by William. In your textbook, they have given a name. Please do name that. And these questions also are very important. Among these 13 questions, if at all you find a single S for these questions, then you are mentally ill health. ఈ 13 క్వశ్చన్స్ లో ఒక్క క్వశ్చన్ కైనా ఎస్ అవును అని కానీ అనిపిస్తే గన డెఫినెట్లీ somewhere your brain is deteriorated and disoriented. That is the main thing from these slides. Clear? Are we clear? Ma ammailo appailo?
Yes, sir.
Yes, sir.
Yes,
Are we
sir.
clear? Very good, ma. Very good. Then they have classified mental and behavioral disorders in ICD-10. In ICD-11 also some people have been tried to define the mental and behavioral disorders, but still we are following ICD-10. So they have classified all the classifications, that is organic, including symptomatic and mental disorders, that is dementia in Alzheimer's disease and delirium, And then mental and behavioral disorders due to psychoactive substances use. What do you mean by psychoactive and psychotropic? Anyone? What do you mean by psychoactive and psychotropic? Nowadays, so much of things have been hearing in media, newspapers, whatever you are following, social media. NCB, psychotropic drugs, drug syndicates, all these things are using commonly nowadays. So what do you mean by psychoactive? And what do you mean by psychotropic? Anyone? ఏంటి అసలు ఏం మాట్లాడరు? ఎవరు మాట్లాడరేంటి? ఫార్మకాలజీ అయిపోయింది కదా. I asked a very simple question. Psychotropic అంటే ఏంటి? Psychoactive అంటే ఏంటి? You have to learn అమ్మా, అలా వదిలేస్తే ఎలాగా? నెక్స్ట్ క్లాస్ లో మళ్ళీ చెప్పాలి నాకు. I will ask you. Okay, so that is a harmful use of alcohol, opiate dependency syndrome, so many drug dependencies are so many. But we will deal in alcoholic and other substances use. That is the next part of the class. Okay, then schizophrenia, schizotypal and delusional disorders. And the examples will be paranoid schizophrenia, delusional disorders, acute and transient psychotic disorders, all these things. Then mood disorders, that is mood affective disorder, that is bipolar, depressive. Then very common things, that is neurotic and stress related and somatoform disorders, that is general anxiety disorders, OCDs, obsessiveness is also one of the neurotic. And behavioral symptoms associated, that is eating disorders, non-organic sleep disorders, all these things. Then regarding disorders of adult personality and behavior, paranoid personality disorders and transsexualism. What do you mean by that? Transsexualism. Anyone? Yes. Are forensic lo chala common word transsexualism. Anyone? Anyone? బాబు వినపడుతుందా నేను అసలు ఏం చెప్తున్నాను?
Yes, sir.
ఎస్ సార్, చెప్పండి నాన్న. మిగతా వాళ్ళందరూ ఏమైపోయారు అసలు? నాట్ అట్ ఆల్ రెస్పాన్సింగ్ అట్ ఆల్. నాట్ అట్ ఆల్ రెస్పాండింగ్. ఊరికే మ్యూట్ చేసి గమ్ము కూర్చోన్నారా?
To live as opposite sex, sir.
టు హ్యావ్
Desire to live as opposite sex person.
very good, Ray, very good. They will be having a desire to lead a lifestyle of opposite sex. They will be having all normal activities. If suppose an example, a male personality is there, he will be having all kinds of emotions and all kinds of secondary sexual characters. He will be able to reproduce, all things will be there, and he will be having children also, but he will be having a strong affair that to lead a woman's lifestyle. He will be having a woman's lifestyle, woman type of mentality, woman type of behavior. That kind of things will be there. That is transsexualism. So many behavioral disorders were there. regarding in sexualism also in these things you will learn, and mental retardation. All these things were classified. Then disorders of psychological development, that is specific reading disorders and childhood autism. Tare Zameen Par, the classic example for this is Tare Zameen Par. And the behavioral and emotional disorders with onset usually occurring in childhood and adolescence. That is hyperkinetic disorders and conduct disorders and tic disorders. And there are unspecified mental disorders too. You don't know the reasons for that. In some way or another way, due to some kind of emotional breakdown, people will behave very oddly. Only that kind of situations only we will see that people are behaving very odd. That is against the nature. And those are concluded under unspecified mental disorders. So again, they have divided a major illness and a minor illness. So in a major illness, that is psychosis, completely off from your mental health, completely off. Psychosis means the first one is schizophrenia, completely outbursting nature, a split personality. Definitely split personality, and always patient lives in a dreams of his own or her own dreams of his own, and he definitely is not aware what at all happening around the world. Definitely he is not at all oriented towards his environment. Always he will be living in his own dreams. That is schizophrenia. Then manic depressive psychosis, that is heights of excitement to depth of depressions. That's where suicidal thoughts and suicidal tendencies will tend to provoke our mind. Both heights of excitements and depth of depressions are highly dangerous for human brain. That's why it has been kept in major illnesses. Then paranoia, which is associated with the undue and extreme suspicion and progressive tendency to regard the whole world in a framework of delusions. That means మొత్తం అంతా మాయ నిజంగానే మాయ, నేను లీడ్ చేస్తున్న లైఫే నిజమైన లైఫ్, బయట జరుగుతున్న అంతా తప్పు, అంతా మోసం. That kind of paranoid people will be there. Extreme suspicion will be there. And some minor illnesses. These are normal situations, normal things. Okay, neurosis or psychoneurosis, and the patient is unable to react normally to the life situations. Some act in very aggressive manner, some act in a very low manner, and the person is not insane, his same personality will be there, but exhibits certain types of symptoms such as morbid fears, compulsions and obsessions. Then personality and character disorders, and this group of are the legacy of unfortunate childhood experiences and perceptions. Unfortunate childhood experience will be there, like single mothers, early breakdown of marriages, divorce, or extreme slavery, extreme poverty. All these things definitely will affect the personality and character of the patient. That's why so many disorders will be coming in an adult life. So what is the basic difference between the neurosis and psychosis? Neurosis and psychosis, and these are the typical examples for that. So for psychosis, example will be schizophrenia, mood disorders, delusions and hallucinations. And for neurosis, anxiety, OCD and conversions. So in psychosis, what will be happening is total loss of insight will be there, judgment will be impaired, contact with the reality is impaired. But all these things will be preserved in neurosis. These are the basic difference between the psychosis and neurosis. Okay, let's just have a clinical scenario. Babu, kanapade vallu chadavandi question. Come on. Anyone? Who is roll number 90? 90 ever. Who is roll number 90? Harshita Padmaja. Is she there? Harshita. So she is absent. I'm marking absent for her. Fine. ఊరికే present అని పెట్టేసి వెళ్ళిపోతే ఎలాగా? Then who is Shravya? Roll number 140. Shravya. Absent. Roll number 117. Chandu. See, no one is responding. How come I will know that whether you people are listening or what? అందరికి absent వేస్తున్నాను చెప్తున్నా. ఎవరు నాన్న? చెప్పు నాన్న. 140 ఏంటి ఇంతసేపు అర్థమైందా నీకు? వినపడట్లా? Come on, Shravya, read the question. Read the question. Read the clinical case
An
scenario.
18-year-old boy came to the psychiatrist, yes, sir, OPD with a complaint of feeling changed from inside. He described himself as feeling strange, as if he is different from his normal self. He was very tense and anxious, yet could not point out the precise change in him. This phenomenon is best called as.
You don't worry about the answer. Just explain what is the case scenario. ఏంటి ఆ 18 years old boy లో ఏం జరుగుతుందో చెప్పండి. What is complaining? చెప్పండి శ్రావ్య గారు.
Yes, sir.
చెప్పండి. So what is happening with the boy? What do you mean that a feeling changing from inside? What do you mean by that? Sir, మీకేం అర్థమైందో చెప్పండి.
Depersonalization, sir.
ఏనా? చెప్పాలి.
Depersonalization, sir.
Depersonalization. Depersonalization. Why you feel like that? Depersonalization. Rahul, roll number 25.
Different from his normal self, Anandkar, sir.
Okay. So ఇది మేజర్ డిసార్డరా, మేజర్ ఇల్నెస్, మైనర్ ఇల్నెస్?
Minor, sir.
Okay. Whatever what you said is okay. Somewhat good. Depersonalization. Very good, Mashavya. Very good. Very good. See, that's how a typical cases will be presenting to our OP. So depersonalization.
అపరిచితుడు మూవీ సార్ అలా
ఏనా
అపరిచితుడు మూవీలు అన్నా సార్.
అది స్క్రిజోఫ్రీనియా
అంటే ముగ్గురు నలుగురులా
complete. That is what is called schizophrenia. He always lives in a dream state. One personality doesn't know another personality. Always schizophrenic. Depersonalization means, that's what I am telling. అందుకే ప్రతిదీ ఇంపార్టెంట్ మన మెంటల్ హెల్త్ లో డిజార్డర్స్ లో ప్రతిదీ ఇంపార్టెంట్. See, that is depersonalization is a state in which a person feels himself becoming unreal and strangely altered, or feels that his mind is becoming separated from his body. Always. సో నాలో ఏదో అయిపోతుంది, నాలో ఏదో జరిగిపోతుంది, నా నుంచి నా బాడీ పార్ట్ కొన్ని వేరైపోతున్నాయి, లోపల నాకు ఏదో అయిపోతుంది, సెల్ఫ్ మాడిఫికేషన్ అయిపోతున్నాయి నా ఆర్గాన్స్. ఇక్కడున్న హార్ట్ ఇక్కడికి వెళ్ళిపోతుంది, ఇక్కడున్న లంగ్స్ ఇక్కడికి వెళ్ళిపోతున్నాయి. దట్ ఈస్ వాట్ ఈస్ కాల్డ్ డీపర్సనలైజేషన్. స్ట్రేంజ్, అన్రియల్. అండ్ మైనర్ డిగ్రీస్ ఆఫ్ హిస్ ఫీలింగ్ ఆర్ కామన్ విత్ ద నార్మల్ పీపుల్ అండర్ స్ట్రెస్. చాలా మంది నాకు తల పగిలిపోతుంది, చాలా తల నొప్పిగా ఉంది, అమ్మా నా తలలో సూదులు పెట్టి గుచ్చినట్టు ఉంది అని దే విల్ ఫీల్. But that is not what is happening in a really. It's a lot of physiology will be there when you get a severe headache. But the perception అనేది different గా ఉంటుంది. Under extreme pain and extreme pressure, it is normal for normal people also. But if you feel always you are having like that of kind of mentality, then you will be having a depersonalization. And severe feelings of depersonalization occur in anxiety neurosis, in states of dissociation, depression and schizophrenia, and in epilepsy, particularly temporal lobe epilepsy. These things will be, depersonalization will be happening in these kind of ali. బాబు జ్యోతి ప్రకాష్, ఆ ఎగ్జాంపుల్ అందులో ఒక పార్టే గాని అదే మెయిన్ పార్ట్ కాదు. దట్ ఈస్ వాట్ ఈస్ meant by మైక్ ప్రాబ్లం. ఎవరికి మైక్ ప్రాబ్లం? మైక్ ప్రాబ్లం వినపడుతుందా మరి నేను చెప్పేది అందరికి?
వినిపిస్తుంది సార్.
మైక్ ప్రాబ్లం అంటున్నారు, అవతల వ్యక్తి మైక్ ప్రాబ్లం.
తనకి మైక్ ప్రాబ్లం అని చెప్తుంది సార్. తనకి ప్రాబ్లం సార్.
ఓకే ఓకే, మీరు రెస్పాండ్ అయితేనే మీకు ప్రజెంట్ ఇస్తాను. సార్ చాలా క్లియర్ కట్ గా చెప్పారు. చాలా మంది ఇలా మనల్ని మోసం చేస్తున్నారండి. కాన్స్టెంట్ గా నెంబర్లు పిలవాలి, ఎవరైతే రెస్పాండ్ అవ్వట్లేదో వాళ్ళకి ఆబ్సెంట్ ఇచ్చేయండి అన్నారు. మీరు చాలా మోసం చేద్దామని అనుకుంటున్నారు, మీరే మోసపోతారు. అలా పెట్టేసి మ్యూట్ లో పెట్టేసి ఏదో చెప్పుకుంటున్నారులే వీళ్ళ బాధ ఇంతే. నో, వినాల్సిందే. ఆన్లైన్ క్లాసెస్ వ్యాలిడ్ అని ఇచ్చారు కదా ఎన్ఎంసి, చూసారా?
చూసాం సార్. yes sir.
ఆన్లైన్ క్లాసెస్ ఆర్ వ్యాలిడ్. యూ విల్ గెట్ అటెండెన్స్ ఫర్ యువర్ అకాడమిక్ ఇయర్. మీరు ఎగ్జామినేషన్ రాయాలంటే మొత్తం ఎన్ని క్లాసెస్ అయినాయి, ఎంతమంది ప్రజెంట్ అయ్యారు, ఎన్ని పర్సంటేజ్ మొత్తం ఇంక్లూడ్ అవుతుంది. ఇది ఎలిజిబిలిటీ క్రైటీరియా మీట్ అయితేనే యూ విల్ బి గోయింగ్ టు యువర్ ఫైనల్ ఎగ్జామ్స్. డోంట్ థింక్ దట్ ఎంసీఏ ఆన్లైన్ క్లాసులు కన్సిడర్ చేయరంట, సో అటెండెన్స్ కూడా కన్సిడర్ చేయరంట అనేది అనుకోవద్దు. క్లియర్ గా ఇచ్చింది మళ్ళీ ఎన్ఎంసి. సరేనా? ఏం లేదు, నా బాధ అంతా మీరు వినాలి అంతే, విని నేర్చుకోవాలి. ఓకే, సో యూ హ్యావ్ ఎ టిపికల్ ఎగ్జాంపుల్ ఫర్ దిస్ అండ్ we will go for another one. Okay, now I will call your name. ఎవరి పేరు చెప్దాం ఈసారి? అబ్బాయిలో చెప్దాం. ఎవరినన్నా ఇందాక ఒకని పేరు పిలిచానే రాహుల్ అని, ఉన్నాడా అతను? రోల్ నెంబర్ 25, రోల్ నెంబర్ 25 రాహుల్. రోల్ నెంబర్ 153 మోహన్ కృష్ణ. రోల్ నెంబర్ 113 మణికుమార్. ఒక్కరన్నా, అందరూ అబ్సెంట్. దుద్దేస్తానండి ఇప్పుడు. 113, 25 ఆబ్సెంట్, 113 ఆబ్సెంట్. ఇంకెవరు? హూ ఇస్ ఈశ్వర్? ఈశ్వర్ రోల్ నెంబర్ 33. చూడు ఎంతమంది ఉన్నారా. రోహిత్ ఉన్నావారా? రోహిత్
సార్
73.
25 సార్ 25.
రాహుల్ రాహుల్ రోహిత?
సార్ రాహుల్ సార్ 25
శరత్
సార్.
చదువు నాన్న.
25
రోల్ నెంబర్
రాహుల్.
25 రాహుల్ చదువు. క్వశ్చన్ సినారియో చదువు.
A 22-year-old young boy shows aggressive behavior for the last 2 weeks, has auditory hallucination, and has developed suspicious behavior. Diagnosis is.
గట్టిగా చెప్పండి. సో వాట్ ఈస్ ద మెయిన్ కంప్లైంట్ ఫర్ దిస్ బాయ్? యంగ్ అడాలసెంట్. 22 years అంటే ఇంకా బాయ్ ఏం కాదోడు, అడాలసెంట్. aggressive behavior for last 2 weeks and has a auditory hallucinations. What do you mean by that? Auditory hallucinations. Can you give some kind of example for that? చెప్పండి, మీ డయాగ్నోసిస్ ఏంటో చెప్పండి ఈ 4 ఆప్షన్స్ లో. ఏదనుకున్నా పర్లే, తప్పైనా పర్లే, రైట్ అయినా పర్లే, వాట్ ఎవర్ యూ ఫీల్స్ రైట్, యూ జస్ట్ ఆన్సర్. చెప్పు జ్యోతి ప్రకాష్, ఆన్సర్ ఏందో చెప్పు దీనికి. He is having a aggressive behavior and he is having a auditory hallucinations for 2 weeks and he has developed very suspicious. చెప్పాలి. తేజస్వి రోల్ నెంబర్ 132 తేజస్విని. Kamalika, you there? No one is responding from. ఉన్నారో లేదో కూడా తెలియట్లేదు. లోహిత్
Schizophrenia.
ఏనానా? మేనియా?
Schizophrenia.
Schizophrenia. Okay, let's see. No, it is not schizophrenic. Schizophrenic means he is not able to tell his complaints. Schizophrenia means complete state of dreams itself. He won't be complaining. He feels that yes, I am very happy and I am living in a real world, but not. Others will be complaining about him, but not himself. But here, he only complains. He only complains that there are some auditory hallucinations for me. నా చెవులో ఎవరో మాట్లాడుతున్నారు, నాకు ఎవరెవరో మాట్లాడుతున్నారు, నాకు వినపడుతుంది. That is what is in the main. The diagnosis will be Acute psychosis, that is manifestation of psychotic disorders include delusions, hallucinations, and severe thought disturbances and abnormal behavior. That is what is meant by acute psychosis. What do you mean by lucid interval? Lucid interval. LUCID. Lucid phase or lucid interval. A very common term used in psychiatry, in psychology. Anyone?
When the person is in their own sense.
Normal behavior in between.
Very good, very good. In between two attacks of paranoia or psychosis, in between the person feel very sane person, very sane, and he will be acting very quiet and he will be acting very normal, absolutely normally. That is what is mean by lucid phase. In two phases. ఒక phase ki ఆ next phase ki మధ్యలో he will feel as a normal person and very quiet personality. That interval is called lucid interval. ఆ lucid interval అనేది గ్యాప్ ఎంత తక్కువ అయితే వస్తుందో అంత సైకోసిస్ డెవలప్ అవుతున్నాం. lucid interval ఎంత వైడన్ అవుతూ వస్తుందో that much of recovery from is there from your mental illness. That's what I am trying to explain you people. From these two clinical scenarios, you should be able to diagnose that kind of manner. దీనికి ఏమి స్పెషలైజేషన్ అక్కర్లేదు నాన్న, ఎంబీబీఎస్ నాలెడ్జ్ సరిపోతుంది ఇలాంటివి డయాగ్నోస్ చేయడానికి. డోంట్ థింక్ దట్ యాజ్ ఇట్ ఈస్ అ డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీ, ఇట్ ఈస్ వర్క్ ఫ్రమ్ psychology. No, a MBBS graduate will be able to diagnose all these kinds of personal mental illness. So what are the various causes for this mental illness? Why so many mental illnesses happening? And they stated that there are some organic conditions such as cerebral arteriosclerosis, neoplasms, metabolic disorders also can cause mental illness. That is, can you give a typical example? What do you mean by Lesch-Nyhan syndrome? Lesch-Nyhan syndrome, what is the characteristic of that? Lesch-Nyhan syndrome, biochemistry చెప్పాలి. It is some kind of organic disease which will be the outcome will be then behavioral disorder. చెప్పాలి. Lesch-Nyhan syndrome అంటే ఏంటి?
Uric acid, sir.
Uric
production of
acid
uric
products,
acid.
excess uric acid.
Very good, very good.